Jim Bird from Safe Harbor Financial is joining us once again on Studio 10. Jim, you brought some folks with us. Who do we have here?
This is part of my comprehensive financial planning team that we work together a lot. And this is Richard Lindsay from ZVAC Lindsay. He's a best-selling author CPA. This is Jim Roberts from Jim Roberts and Associates. He's also a municipal judge in Spanish Fort.
Morning.
All right, good morning to you guys. Thanks for being here. Today we're talking about Obamacare and some of your thoughts on what exactly Obamacare is. I know a lot of people hear the term, but they don't know exactly what it means. So let's start, guys, with what is Obamacare?
Well, I'm going to pass the buck a little bit on this, Joe, and pass it over to Richard and Jim. You know, they're the legal experts on that. On investment side, it's not really changing a whole lot other than you got to be prepared for upcoming tax increases.
Sure. So how about some generic information, guys, then about what exactly is Obamacare?
Well, Obamacare is the nickname, if you will, applied to the Affordable Care Act, passed in 2010. And basically, it is probably the largest, the most significant change in health care in the United States since LBJ passed the Medicare Act in 1965.
Why is it such a major change, for those who don't know?
Well, the idea or the plan was to pull in about 33 million people who didn't have health care before and get them health care insurance. It's estimated that there's like 44 million people that don't have it, so we're trying to pull in like 75% of those people. And the biggest, there's lots of ramifications there, and some of it's intended, some of it's not. But one of the things that we think will happen is that we'll see people, we'll have more people with health care insurance. And so depending upon who you talk to, this could create a flood of people, if you will, that now see doctors that used to be going to either emergency rooms or not getting health care at all. But if that were the only problem, then we'd eventually just get more doctors. But the problem is, part of it also puts more people under Medicare and Medicaid, which means the doctors get less. So the doctors are going to end up either having to do one of two things, kind of like they're going to have to see more patients or in a shorter period of time, or they're going to go to a kind of a concierge model where you pay a flat fee to be eligible to be a patient of theirs and go from there.
Let's talk about, you mentioned some people still don't have it. So one of the questions that we had for you are, what are the consequences of not purchasing health insurance?
Well, there are a couple, and all this hasn't played out yet. You know, one of the things, playing off what Richard said, this is going to involve up to 1/6 of the economy. These are huge, huge numbers. And, part of it is that for those who don't have insurance and can't afford it, there will be exchanges set up where you go on and purchase insurance, and if you can't afford it, which is part of the problem, then you're given vouchers or discounts for the purchase of that insurance. So in effect, you're still spreading the same cost over the same taxpayers, except there's been a huge governmental increase in the cost because they've added thousands and thousands of IRS agents because the IRS has been charged with the duty to oversee this and to make sure everything's collected. So while we're also adding 33 million or whatever that number is to the possible protected or insured rolls, you've added this huge increase in cost for government. Then one of the interesting things about it is if you don't pay your taxes, they can prosecute you. But on this, if you don't pay, they can penalize you and they can sue you, but it's not going to fall under the same income tax kind of guidelines for criminal prosecution.
Mentioning a couple of the problems here, one of the other questions, though, is who will Obamacare help?
Well, as you said, if there are 45 million people without health care, today I saw an article where illegal immigrants were at hospitals pushing for coverage of organ transplant. I mean, you'll have, what we're really doing is the young who don't have their insurance because they think they're, that they're bulletproof, and they've been at it already up to their parents at 26. You'll have elderly who should already be under a Medicare, but depending on where they land, you would have unemployed, like I said, are heading to emergency rooms. You would also And I think there's just a great shadow group that nobody knows. And how does that all work out in terms of who shows up? It's like when they do a census and you can't get people to fill out your census forms. You don't know who's going to come out of the woodwork in terms of establishing what's the true number to be covered.
Well, Jim, I'll close it out with you then, because when you talk about any sort of insurance, it always has an effect in your long-term financial planning as well. Why is it so important to know these things about Obamacare?
Well, the one thing that we say, Joe, is beware, because taxes, they are coming. Because who's going to pay for this? It's going to be increased taxes, so that's going to make tax planning even more important, Joe. You got to put things into tax-efficient investments and cut your taxes down as least as possible so you have more spendable income at retirement. And that's what we do. We coordinate all this together with Richard and Jim and ourselves to make sure that you're prepared for a long retirement.
All right, and if you have any questions about how to further prepare for all that, feel free to contact these guys at Safe Harbor. We'll have all the information on our website so you can go check that out. Thanks for your thoughts on Obamacare today, fellas. I'm sure the folks out there learned a lot.
Thank you,
Joe.